All right, guys, let's begin and keep asking your questions in the chat box. So, PLAB-2 roadmap, that's what we are here for to discuss here. And congratulations, yeah, those who recently passed PLAB-1, yeah, you are now near to get your life settled in the UK, one step closer now, yeah. Okay, so Aspire Academy. So we've been doing our courses from last 8 years actually now. We did start our academy from London. So we were there in about 2 years in London. Then we did spend around three and a half years in Manchester. Now from roughly 2 years, I would say, we are in Blackpool, right? So it's near Manchester only. So usually candidates, they travel to the exam center maybe a day or maybe on the day of the exam. So that's what we have, right? Our full courses, what it contains, I'll explain it to you. I'll explain. And I just want to talk about myself a bit. Yeah. So this is me, Ankur Garg. I don't look like this. Maybe I look like this, I would say. Yeah. So the academy was started by me and Dr. Nikhilesh. So that's Dr. Nikhilesh. This is, I think you understand what is Zibli. I mean, this famous nowadays. Yeah. So we are doing the most of the classes in the academy. We have got our other tutors as well, but mainly like the main topics, if you see from medicine, examinations, ethical stations, you'll see I'll be teaching. And if you see some other important topics like prescription, SIMMAN, you will see Dr. Nikhil is teaching. Yeah. So these are the main tutors of Aspire Academy. Yeah. So let's begin. Let's begin PLAB-2 introduction. Yeah. So what are the things that you need to be aware of? Yeah. First of all, this exam, this is an OSCE exam. Yeah, this is an OSCE exam. What do you mean by OSCE exam? So in your life, you have given so many exams, right? So what happened is mostly our MCQ exam, mostly a written exam, but this is a real consultation, patient-doctor consultation. Obviously, the patient that you're going to get in the exam, they're not real patient. They are actors. They're professional actors, but you have to talk to them. That's how it works, right? And you'll have 16 different patients in your exam. And you will get 8 minutes each with each patient. I mean, 8 minutes with each patient. So the consultations are time-bound. It's not like you'll have unlimited time with your patient. No, it's a limited time. 8 minutes you'll get with one patient. And you'll get 16 scenarios in the exam, right? And there will be a task outside the cubicle. You have to read that task and then you're going to go in. In that task, they'll be telling you what is the presenting complaint of the patient and what you're supposed to do. So that's what happens actually, right? So the total number of scenarios 16, and you will be reading a task outside and you'll get 1.5 minutes to read that task. I know 8 minutes and then 1.5 minutes. I will say one station is going to take roughly 9 minutes and 30 seconds. That's what happens, right? But the thing is, it's not that easy, isn't it? It's really challenging to talk for that long time. So that's why they have got in between 2 rest stations as well. So they have got 16 stations where you'll have the patient, you'll be talking to them. Plus, they'll have 2 rest stations as well. So you're resting, you're having a glass of water, a glass of coffee, cookies if you want, you can have that. So this is how it works. And the total duration of the exam is 3 hours roughly. And if I ask you a question, do you think it's easy to talk for 3 hours? What do you think? It's not that easy, isn't it? We get tired as well. Moreover, the thing is, you have to talk in full concentration, which is a challenge. So be prepared for it. Yeah. So when you do the mocks and all, you'll get a bit of idea and you'll feel more into like, yeah, I can do it. Yeah. And what kind of consultations are you going to have in PLAB-2 UKMLA exam? So you have a station from history. History can be any history, medicine history, surgery, gynae, pediatrics, psychiatry history. Then you have station from counseling. You'll have ethical scenario. You'll have examination mannequins, teaching scenarios, SIMMAN prescription, and then some tele and video consultations. If I break it down, usually in the exam, you have one prescription. You may have one SIMMAN. I would say 2 to 3 examination mannequin and teaching, roughly 3 ethical scenario, 3 counseling scenario, and maybe roughly 5 to 6 history scenarios. History, I would say maybe 2 from medicine, 1 surgery, 1 gynae, 1 peds, 1 psychiatry. So in total, it becomes 16 scenarios, right? Again, it's a rough idea. Nobody has given it. It is just, we have observed in the last few years, this is how they get, right? So 16 in total. Now, after COVID, what happened is they started giving us lots of teleconsultations as well, right? So there are some tele. After COVID, when the exam started, there were like 8 to 10 teleconsultations. The whole of the exam was teleconsultations. But nowadays, the teleconsultation are there, but they're very less in number. How many teleconsultation nowadays? I would say one, two, two. Mostly two nowadays. Now, which two station? Any station, maybe any history station, counseling station, or ethical station, they can give as a teleconsultation, right? Now, if you look into examination, sim and prescription, obviously that cannot be given as teleconsultation. So that is going to be in person. But from history, counseling, ethics, they can give maybe one or two teleconsultations as well. Teleconsultation, nothing difficult. I mean, you'll not be having the patient in person. The patient is going to be on the phone. So the phone is there in the cubicle. You go and talk to the patient on the phone. That is it. Right? So this is how it works. Yeah. Now, when you get the result, how we know we passed the exam? So you have got 16 stations, right? And each station is of 12 marks, guys. Each station is of 12 marks. And these 12 marks are divided into three headings. Three headings means number one, data gathering, that is 4 marks. Then you have got the management, that is 4 marks. And then you have got IPS, interpersonal skills, that is also 4 marks. So each station divided into three domains, 4 marks each. So in total, it's 12. How much score I should get so I pass the station? How much score? Again, it's not like fixed. For example, you're given your PLAB-1 and there is no fixed passing score for PLAB-1. Now you got your result in April, the passing score is different. I mean, those who are still not given PLAB, they're going to give maybe the next time. So they will get the result. The passing score is going to be different. Those who are passed maybe last time, 2 months, 3 months ago, the passing score was different. So that's what happens in PLAB-2 as well. The passing score is different all the time, and passing score for each station is also different. We cannot just categorize, okay, I mean, out of 12, if you got 6, if you got 7, you pass the station. No. For one station, the passing score could be 6, another it could be 7, another it could be 8, another it could be 9 as well. So different station, different passing score, right? So that's how you're going to get your result nicely. Yeah. To pass this exam, you have to fulfill two criteria. Number one criteria. So there are two criteria. So number one criteria is you need to get above the average score. Get above the average score. So what's total score? Total score is you have 16 station, 12 marks each. It becomes 192. Now what's the total passing score for the exam? Again, I said it's different for different days, right? So what we have seen in last few years, I would say the passing score is roughly 110 plus minus 5. That's the passing score you should, right? So that's the first criteria that you need to fulfill. And the second criteria is you need to pass a certain number of stations as well. Initially, if we go before November 2024, they used to say we have to pass 10 out of 16 stations. That used to be the criteria. But now the criteria is not this. They say we will decide the number of station on different days. So usually what used to happen initially before November 2024, those who are getting above the average score and they are passing only 9 stations, they were like failing the exam. But now what happened is every day they will decide what is the total number of stations they need to pass. So sometime it can be 9, it can be 10, it might be 11 as well. But to be honest, in last few months, I mean in December, in January, in February, in March, not March because the result has not been announced yet most of the time, most of the results. So mostly we have seen even candidates, those who pass 9 stations, they pass the exam actually. So it is actually better. So to pass this exam, what you need to do, you need to get above the average score and you need to pass a certain number of stations as well. How many? It's not very clear how many, but I would say if you pass 10, 11, you're going to pass the exam. So out of 16, you are just supposed to pass 10, 11, not like all 16. So there is a lot of buffer, I mean, we have got. Yeah. So that's the main thing. Okay, so in the exam, they're actually checking us on these 10 skill statements. So if you see the result you get, this is the one sheet you get, and this is the another sheet of results you get for the exam, right? So they are marking us on these 10 skill areas: consultation, diagnosis, examination, findings, issues, language, listening, management, right? So let's see a bit more about it. Any question if you have got, guys, just keep putting it in the chat box. Yeah. So, consultation. What do we understand by consultation? Consultation is a smooth consultation. We should flow like nicely, isn't it? So, for example, when you take a history, you have got presenting complaint. What do? You elaborate the presenting complaint. You ask some associated symptom. You rule out some red flag, killer, emergency differentials. Then you have got your past medical history, lifestyle history, social history, and you close the station because you get your diagnosis and you try to conclude it accordingly. So there is a pattern. Do not jump. Do not jump. If it becomes unstructured, it becomes illogical, you will not get good score and they will mark you down in your consultation. Sometimes they write the word you when they give you this statement. I mean, I have written a tick here. Sometimes they write the word you. You means what? You simply means unsatisfactory. So make sure your sheet is very nice, clean, and clear. Yeah. Issues. Recognize the issue, right? Now, a question for all of you. Answer me. If you get a patient, are you going to do medical treatment first or non-medical treatment first? Medical treatment first or non-medical treatment first? Answer. Issues. Medical treatment first or non-medical treatment first? So I got non-medical, non-medical, non-medical. Now, medical as well, non-medical. Okay, mostly saying non-medical. Now, the thing is, I would say it depends on the patient, isn't it? I mean, it depends. So I mean, if the patient is it's an emergency scenario. Patient is struggling to breathe. It's an acute exacerbation of asthma. I can't breathe. My asthma is killing me. And his saturation is 80. And you're saying, don't smoke, don't drink alcohol, go for a regular walks. Does it make sense? No, it doesn't make sense. So medical treatment first or non-medical treatment first? It depends. It depends. It depends on what? It depends on my patient. Our doctor, I'll see if I need to do medical things first or if I have to do non-medical things first. All right. So that's the main thing. Yeah. Then we have got the time. The time is the problem actually, I would say, because you have got 8 minutes and you have got three domains: data gathering, management, IPS, interpersonal skills. Yeah. So how much time you're going to spend on data gathering? How much time you're going to spend on management? Now, the problem in this exam is, see, will you be having any clock in the room? The answer is no. They don't have any clock in the room and you are not allowed to carry your watches as well. So how are you going to get the idea about the time? That's the challenge, right? So how are you going to get the idea about the time? So there's a bell system. There is a bell system. So what happens is when you're outside and after 1.5 minutes, what's going to happen? There is a bell saying begin. Begin. Begin means you go in the room, and then in the room you have got 8 minutes. So what happened is after 6 minutes, there will be a bell saying 2 minutes left. And then there is another bell saying move on to the next station. So that's the only thing that will give you a bit of idea about the time. That's it. You are not allowed to carry your watches. There is no clock in the room. There is a clock outside the room when you're reading the task. There is a timer going on. But when you go in, there is no timer, no watch, right? So only this bell, 6-minute bell, it will say 2 minutes left. And then it will say move on to the next station. So that's the only idea about the time management that you have got. Okay. So now, how much time you're going to spend on data gathering, how much on the management? See, IPS, interpersonal skills, is how you're talking to the patient, how you're making the patient comfortable. That's your interpersonal skills. I'll talk more on interpersonal skills later. But then how much time for data gathering, how much for management? Now, I've seen a lot of candidates, what they say, 6 minutes, there is a bell, so I'll do 6 minutes history and 2 minutes for management. Do you think it's an ideal way to do it? Do you think it's a good idea, 6 plus 2? The answer is no, it's not a good idea. And management is not just saying the management. Management is involving the patient in the management, involving the patient. Another is let the patient ask questions. They have come to you because they have got some questions. They want the answer of it. So what do? You have to give enough time to them. So if you have got only 2 minutes, you'll be in a very haphazard manner, you'll be doing the management, which is not ideal. So what you should do, 4 and 4, that's what we say. 4 minutes for data gathering, 4 minutes for management. That's what you are supposed to do, right? I know there is no bell after 4 minutes. So you might be thinking, how will I be knowing it's 4 minutes? So the thing is, when you practice, you have to practice in a way. Because before the exam, we advise you to practice at least for 2-3 months, right? So when you're practicing, you practice with the timer. So you get a bit of idea. It's now roughly 4 or 4.5 minutes. It's already done. So you should be moving to the management as soon as possible, right? Please take care of the time. Findings, identify normal findings or results. Obviously, they'll give you some positive findings in the history, some in examination, some in the investigation. Make sure you're able to get it properly and you interpret it accordingly. Examination, make sure you do the proper examination and use any instrument if they have given you proficiently, nicely. Yeah. Diagnosis. Now, the question is, will you be able to make the diagnosis in all the scenarios? Will you be able to make the diagnosis in all the scenarios? The answer is no, we can't. We can't make the diagnosis in all the scenarios. If you can make it, it's okay. If you can't, so if you are sitting in your clinic and if you can't make the diagnosis, what do you do? I will simply say you'll have some differentials in your mind, yeah, and you will investigate the patient accordingly. Fine. This is what you have to do in the exam as well. In the exam, if I say very simple line, in the exam, they want to see you as a doctor, not as a medical student. If you behave like a doctor in the room, you'll pass this exam. Right? So if you're not able to make the diagnosis, just say, for example, you got a station where patient is having cough and fever and shortness of breath, and you have got few differentials going on in your mind, and you're not sure which one it is. You can say, Sir John, see, you have got cough for the last few weeks now. You have got shortness of breath. You've been having fever as well. And you said you have lost significant weight as well. And you are 25 years. So there are a lot of things going on in my mind. It looks like you might have some lung infection. I'm not sure which bug is causing it, but looks like it's infection. So what I have to do is I have to do some further investigations for you. I'm going to do some routine blood tests. I'll check your phlegm sample, right? And we'll take phlegm and we'll send it for investigation. And we may consider doing your chest x-ray as well. Once I have got the report of these things, I'll be able to manage you in a better way. But don't worry, you said you have fever, I'll give you something for your fever. You said you have cough, I'm going to give you something for cough as well. And then you can give the warning signs and all, and we finish it. So this is how you can give your management, right? So that's the thing. So if you got the diagnosis, good. If you didn't get the diagnosis, it's not like you failed the station. Yeah. Management. GMC says very simple thing. Management must include follow-up and warning sign. So when you close the station, I would say last 30 seconds, last 20 to 30 seconds, you have to devote for this management part. You have to tell the patient about follow-up and you need to tell the patient about the warning signs. For example, if patient has got cough, tell the patient if your cough is getting worse, if you're having any blood in the cough, come back to us. So that can be your warning sign. Yeah. Then we have got rapport building. Make sure you build the rapport. Rapport is making the patient comfortable. How you can make the patient comfortable? Any idea? Tell me how you can make the patient comfortable. Anything if you have got in your mind, tell me. Rapport, make your patient comfortable. So, how you make your patient comfortable? There are lots of different things you can do. I would like to hear some from your side. So, somebody mentioned like we can do ICE. Yes, that's good one. ICE is your idea, concern, expectation. I'll talk a bit more about ICE in the webinar. Ask them what they expect from us. Very good. Taking his or her name, that's good. And empathy and expectation, yes, you have to be you have to be empathetic, yes. And also, I would say listen to the patient. I mean, the very common thing I would say, I mean, you might be thinking, what the hell I'm saying? Listen to the patient, because the countries we come from, you may not be listening to the patient that well. Why? Because you have to see so many patients. You have to see so many patients in one day, and you may not have enough time to react accordingly, isn't it? So you don't have time to listen to them. But here you have to make sure you have to listen. If they're talking, do not interrupt. If they're talking, let them talk. And if they're talking, what you can do, maybe you can nod your head. Okay, yes. All right. Right. So this is something that you need to do. So these are the active signs of listening. Right. Rapport building is you have to show them that, yes, I'm here to help you. And these 8 minutes are dedicated to you. And you have to sit in a way like, yes, I'm here. Have a bit of smile on your face. So you have to be presentable. It's not only a medical exam. It's a acting exam as well. It's a medical exam as well. And it's how you carry out yourself. Overall, how you do things, that's what it is. You don't have to talk from here. You have to talk from the face. You have to talk from the whole body. Use your hand gestures. Show that, yes, I'm here to help. Then only we can pass this exam. Right? So that's the thing. And you will see patient might be interrupting you in the station. You make sure you do not interrupt them. That's really important. Yeah. Okay. Listening, pick up verbal and non-verbal cues. What I mean by non-verbal cues. So verbal is doctor, I'm having pain. Doctor, I'm having cough. Doctor, I'm having shortness of breath. Doctor, I'm having constipation. Doctor, I'm having tummy pain. That's my presenting complaint. I'm telling you. But there are some non-verbal cues you might get in the exam. What do you understand by non-verbal cues? For example, patient is not looking at you, just talking but not looking at you and doing something like this and that. So there is something more in the station. So what you should do, if you see something unusual, you have to acknowledge it. John, I can see you are looking down. You are not comfortable. Is there anything I can do for you so that you feel more comfortable? Do something like that, right? So this is what we call as non-verbal cues. They will not say, but they feel that thing. So you need to pick those things as well. Yeah. Language, make sure you don't use medical jargon. So you're talking to a patient, use patient-friendly language. So these are the feedback statements they will be checking you on, right? Okay, and what kind of task they will give you in the exam? So this is the kind of task candidate instructions. And this candidate instructions you will be having outside and you'll be having 1 minute and 30 seconds to read these instructions. And the same paper will be there in the cubicle as well. Because if you feel like, oh, I forgot something, I need to see the task again, no problem. You'll be able to see the task in the cubicle as well, right? So the task is roughly like this. They will tell you where you are. They will tell you who the patient is, other information you have about the patient, what you must do, special note. So they will be telling you briefly about the scenario. So you are a foundation year 2 doctor. In every scenario, you will be foundation year 2 doctor. You will be an FY2. Who is an FY2? An intern. So in all the station, you will be an intern. That's it. Yeah. Then FY2 in GP, in medicine, in rheumatology, in surgery. So you'll be different departments. So you'll be knowing what I'm supposed to do if I'm in this department. If I'm in the GP, you know what GP can do. If you're in the A&E, you know what to do. If you're in medicine, you know what to do. So it is very important for us to know where we are. Then who the patient is, Stanley Smith, age 45, was referred by the GP because of the pain in the right big toe. So they'll give you a bit about presenting complaints. So you will be knowing what you are dealing with. Yeah. Other information about the patient. Sometimes they say none, no other information. But sometimes they might be giving you some extra information as well. Maybe patient is hypertensive, patient is taking thiazides, patient is not compliant with the GP for his diabetes. So they might give you some extra information. What you must do, talk to the patient, assess him. Assess means what? Assessment history plus examination, right? And discuss the management with the patient or with the examiner. Please check the question and see, is it with the patient or with the examiner, right? Mostly it's with the patient, but maybe in some station it might be with the examiner as well. So please manage it accordingly. Yeah, and they might have this special note. Sometimes they have nothing. They will say none, no special note. But sometimes they have patient is worried, patient is angry, and another very important thing I'll say, if you're not talking to the patient, you're talking to the relative, for example, you're talking to the spouse, you're talking to the husband or wife. So you have to see one line in the special note that consent has been taken. Consent has been taken. So that's the main thing. Because if you don't have the consent from the patient, you cannot give the information to the relatives. Right? So this is very important. Yeah. Now, yes, a history and examination and a management in 8 minutes. Yes, you have to do everything in 8 minutes. But you know, many times the history you will be doing for examination, sometimes you have to do the examination, but sometimes you just have to mention, I would like to do this examination, and the examiner will give you the findings. So it can go that way, but you are right. Sometimes you have to do the examinations as well. I know it might be challenging. You're like, how should I do everything in 8 minutes? But the thing is, you're supposed to do focused history and relevant examination. You're not doing full history, you're not doing full examination. It's a focused history and relevant examination, right? So don't worry. When we come for the course, we'll explain all these things. And in the course, what we do, we usually practice. So we'll tell you how much history, how much examination, what part of management is the most important. That is our main aim of doing the classes, right? Okay, so history, how you do? First of all, greet with a smiley face. You know, we underestimate this thing. Greet with a smiley face. See, now a lot of people they debate, okay, our patient is in pain and you are laughing. See, I'm not saying laugh, I say smile. There's a difference. You are smiling, it makes you feel more confident. Others are like, this doctor looks confident, isn't it? I'm not telling you to laugh on their symptoms. I'll just say carry out yourself with a bit of smile on your face. So they feel like, ah, this doctor looks confident. I can trust him. But if you're very stressed on your face, and also patient will be thinking, ah, this doctor is stressed. I don't think so. I can trust this doctor. I have to see another doctor, isn't it? So you have to be very, 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 very careful on these things. Yeah. So greet them with a smiley face. In every station, what you need to do is you have to introduce yourself and you need to identify the patient details as well. So you need to identify the patient details as well. Fine. So how will you introduce yourself? So if I have to do, I'll say, hello, I'm Guru, the doctors. May I get your name and age, please? Yes, I'm Stanley. I'm 45. Hello, Stanley. Nice to meet you. What brings you to the hospital? How can I help you today? So that's how you're gonna start the case, right? The name of the patient, the name of the person you're talking to is given to you in the question. If you would like to use that name, that also can be done. For example, hello, I'm Ankur, one of the doctors. Are you Mr. Stanley Smith? Yes, doctor. What's your age, if you can confirm for me? Yes, it's 45. Okay, and how would you like me to call you? Yeah, you can call me Stanley. Hello, Stanley. Nice to meet you. How can I help you today? So this is how you will start the station. And I would like you to practice these things quite a lot because I mean, you have to sound confident in the first minute. I think all of us, we have heard one phrase. First impression is the last impression. Make sure it's good. So when you enter, this is the first line you're gonna say. So say it with confidence. Have a bit of smile. Say it with confidence. So patient will be in your control, I would say. Yeah. Okay. So now, how you take history? So first of all, the presenting complaint. What kind of presenting complaint you will have in the exam? Patient might have pain. The presenting complaint could be cough, could be shortness of breath. The presenting complaint could be fit, fall, loss of consciousness, dizziness, vertigo. So lots of presenting complaints. If it is pain, how you elaborate it? You do Socrates, and every single thing in Socrates is important, right? I think everywhere in the world we use this mnemonic only, yeah? Pain, site of pain, S is site, O is onset of pain, character of pain, radiation of pain, associated symptom, time, any particular time of the day you have got pain, any exacerbating and relieving factors, and severity score. What is the severity of this pain? On a scale of 1 to 10, 1 is the least, 10 is the worst pain you have ever experienced. So that's how you elaborate. If the presenting complaint is not pain, but it is cough or shortness of breath, so maybe you can use OD-para, onset of cough, duration of the cough, intensity of cough, progression of cough, associated symptom, any exacerbating and relieving factors as well. And also you'll ask if it is a productive cough or if it is dry cough and if there is any blood in the cough. So that's how you're gonna do things, right? If you have got fit for loss of consciousness, how you'll take history? You'll take history in 3 different parts: during, after, and before. During, for example, if it's a fit, how long the fit lasted? Is it generalized or localized? Whether you had uprolling of eyes, tongue biting, incontinence, right? And after the fit, how are you feeling? Whether you are confused or drowsy, sleepy, you had nausea, vomiting, any trauma, did you remember the event, what happened before or after the event? So all those things you're gonna cover in that. So presenting complaint, make sure you elaborate it nicely. So that's what happens, right? So history taking, you have got presenting complaint, then you will elaborate the presenting complaint. You will do your complete Socrates or OD or Ra. That's what you are supposed to do, right? And then you'll ask some associated symptoms and you rule out some important differentials as well. And then you will come up to your diagnosis, right? And then past personal social history. Let's go a bit more into detailing of it. And let me show you this slide actually. This slide covers everything. Let's come back to it. So first thing I would like you to do is you introduce yourself, you identify your patient details, and then what you say, how can I help you? How can I help you? You have to go with an open question. Patient said, I'm in pain. What you should do, I've seen a lot of people, they say, where is the pain? For how long you have pain? Don't say that. What you should do, could you please tell me more about your pain? Another thing, a lot of people ask me how I can be more empathetic. See, tell me more about your pain. Could you please tell me more about your pain? Did you feel the difference? If you want to be more empathetic, start your sentence with kindly or please. You will see you will be more empathetic. Yeah, that's the main thing. Yeah. So tell me more about it and what you do. Patient will tell you a bit about pain. Whatever they have told, it's okay. Whatever they have not told you, you will elaborate. You'll ask it completely and you'll finish your Socrates, you'll finish your Odipara, right? Let's take an example. You have got a young female patient, 27 years, having pain in, let's say, right iliac fossa. Give me the differentials. Give me the differentials, guys. A young female pain in the right iliac fossa. So how can I help you? Tell me more about and you elaborate the pain. So what will be the differential? We have got a young female pain in the right iliac fossa. So I would say appendicitis. Yes. I would say ectopic pregnancy. Yeah. I would say ovarian torsion. Yeah. I would say UTI. Okay. I would say stone. Okay. Tubo ovarian abscess. Okay. I would say STI, PID. Yeah. What else? IBD. Okay. I will say IBD. Oops. IBD. Okay. Pyelonephritis. I'll say stone pyelonephritis. Yeah. Does that make sense? Okay. Constipation. Okay. Then it's a generalized pain in constipation. Okay. You want me to write that? Let's write that as well. So I think it's enough. Yeah, colic, stone, we have written that. Great. Now the question is how many differentials you should be ruling out? How many differentials you should be ruling out? I would say a lot of people say three, four. I would say you can't decide on that. And just with this, I would like you to do proper Socrates. When patient says, I've got pain here, right iliac fossa. So where was the pain when it started? Doctor, it started here. Let me do the full Socrates. Doctor, it started here. It is still here. It is 5 out of 10. It started yesterday. I'm taking paracetamol and it's helping a bit, but the pain is still there. It's not going anywhere. And it's a 5 or 6 out of 10. Right. What I did, I didn't try to rule out any differentials. What I did, if you agree with me, I just did the elaboration of present and complaint. Patient said the pain started there and it is still there. So it cannot be appendicitis. That's one. So appendicitis, can it be? I would say appendicitis is out of my list. Appendicitis starts from the umbilicus and it goes to the right iliac fossa. But here I said it starts there, it's still there. So appendicitis is out, right? What else? Now, stone pain, paragraph stone, where exactly the pain is? First of all, it's not there as well. Why? Stone pain usually starts from the flank and it comes to the groin, but patient is saying it's not going anywhere. So it's less likely to be stone or pyelonephritis as well, right? I'm not saying it's not, but I would say it's less likely to be, right? Now somebody said ovarian torsion. How severe the pain is if it is ovarian torsion? Can I say it's 9, 10? I mean, and can you think, I mean, do you think patient can wait for a day or two? Not really. So I would say this is also out of my list. Guys, I am not trying to rule out any differentials. What I just did a good Socrates. That's it. So what I'm trying to say is, when you do a good Socrates, you have ruled out so many differentials already. So that's what you're supposed to do. Now, okay, so I'm left with all these things. Now, what I'll do, once you're done with the elaboration, you're able to rule out some differentials. Now, what should be your next question? Your next question should be, is there anything else? I mean, patient gave you pain, you did elaborate the pain. If the patient has got anything else, and patient is like what? What do you mean? Now, what you will do, you will start asking close questions. I know you have got so many questions. Good. So now we'll ask maybe which question I should ask. Patient said nothing else. So I'll ask about fever. I'll ask about nausea, vomiting. So for example, patient said, yes, doctor, I've been having fever for last 2 days. I'm taking paracetamol. That's quite helpful. Okay, so fever is there. So what I understand is it could be what? So it could be fever, it could be UTI, it could be tubo-ovarian abscess, it could be STI, PID, maybe IBD, I'm not sure, but these are the things I've got in my mind. Yeah. Now, what I will say after elaboration of fever, I'll ask nausea, vomiting. Patient said, yes, I'm feeling nausea, vomiting as well. Okay. Now, you need to rule out some differentials as well. You have to make your diagnosis here. So what question I should ask? Now somebody is saying pregnancy or LMP. Okay, let's ask. Let's ask, when was your last menstrual period? Doctor, 2 weeks ago. 2 weeks ago. So can it be ectopic? Not really. So ectopic is out of my list. UTI. Do you have burning sensation while passing urine? Do you think you are going to the loo more often? No, doctor. Out. Right? What else is left? STI and PID is a main important thing, and patient is young female. So take sexual history. Now, one more question. A lot of people come to me with this question. So, sexual history usually we ask in the later part of the station. Should I wait till here? Should I ask sexual history now? What do you think? Should I ask history now? Or do you think I'll be moving here and there from my consultation skills and they might not like it? Should I ask sexual history now? Should I waste it later, till later? I would say ask it now, now, now. If you will not ask now, you'll have nothing in your hand. You took sexual history and patient said, yes, I've been having multiple sexual partner and all. So what do you understand by this? It could be STI. It could be STI. So that is something you will have in your mind. Now, I'm going to rule out tubo-ovarian abscess. I can't rule it out. Let's see. For how can you rule out IBD and constipation? So you can ask any constipation, or what else you can do? You can ask like any diarrhea or constipation, any tummy pain. No, 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 no. I mean, tummy pain is there, but no diarrhea, no constipation. So IBD is out, constipation is out. So what we are left with, tubo-ovarian abscess and STI or PID. But the thing is, mainly it's going towards STI PID because patient has got multiple sexual partner. Later on, what I'm going to do, I will do an ultrasound scan and it's going to be very clear, is it abscess or not? So how many differentials I ruled out? So many. But how many questions did I ask to rule out these? Just a few. And that's what you have to do in the exams. Who's a good doctor? Who asks less question? Who's a good doctor? Who gives less medication? So that's what you have to do, right? Okay, signposting. I'll come to that signposting, doctor. You're absolutely right. When we're starting how to do signposting, I'll definitely come to it. Wait. So I mean, this part of the thing, if you remember these 4 or 5 lines properly, you'll be able to do any station actually, right? How can I help you? Tell me more about it. Any other symptom if you have got. Just remember this, life will be easy, right? And you should have your diagnosis till this point. You should have your diagnosis till this point. After that, you have to have a risk factor, past personal social history, previous similar episode, medical illness, medication, allergy, hospital stay, surgery, family history, smoking, alcohol, diet, physical activity, stress, drugs, sexual history, travel, occupation, living condition, driving. So many questions are there. If you count them, these are like 18 to 20 questions. Now, are we gonna ask all 18 to 20 questions? The answer is no. If you ask every single question, how much time it's gonna take? It will take maybe 2-3 minutes of my time. I don't have that much of time. So what you should do, the main mistake most of candidates do, they ask every single question, and that's the worst thing that you can do. You have to ask only, I would say, 4 to 5 questions. Which question? The questions which are important. Let me give you an example. With the history, you got to know patient has got cough, patient has got hemoptysis, patient has got weight loss. So you understood it's going towards lung cancer. So which question I will ask? Any previous similar episode? Any family history? Smoking history? Occupation history? And that's it. Done. So only the related ones you need to ask. Don't ask every single question, right? Then make sure you can ask, is there anything else that I should know? If you're missing something, patient might be able to help you. Patient's concern, keep asking the concerns. If there is any concern, make sure you address it. And impact of the illness on the patient's life, very important. Psychosocial history is very important. You are not only treating the patient medically, you are treating the patient overall. That's very important, right? So for example, your patient is saying, oh, doctor, I'm feeling tired for last 2 months and I'm not able to help my children in their homework and all. So that's very important. Treatment of tiredness is separate, but what impact this tiredness has impacted his mental health as well. That's very important for us to know as well, right? Okay, so once you're done with the history, so this is your history. This history should be done in 4 minutes time. I know it's a challenge, but when you practice and more practice, it can be done. Then it comes to the management. So this is your management part. So what you do in management, after taking history, you mention about examination, you mention about initial investigations as well. So are you doing examination or you're just mentioning about the examination? It depends actually. It depends on scenario to scenario. Some station they're expecting us to do the examination, brief examination. Some station they will give you the findings. So for example, I'm doing the station young female pain in the suprapubic area, and patient is saying, I'm going to the loo more often. Patient has got nausea, vomiting, patient has got fever. So it looks like a case of UTI. Okay. So which examination I should do if I'm suspecting UTI? I would do general physical examination. I'll be checking the observation, the vitals of the patient. And what else I'll be doing? I will be doing tummy examination, right? And you have to do the brief initial investigation. Which investigation you'll be doing? You'll be doing urine test. Because what happens is before you give the diagnosis, you should be mentioning about initial investigation and examination because they might be giving you something. Now, examiner might say patient has got tenderness in suprapubic area and urine dipstick shows the patient has got leukocytes and nitrates. What does it mean? It means UTI. I have got the history, I've got the examination, I've got the investigation. Disclose it. Say, you have got UTI. You have got UTI because you have got pain, you have got fever, you have got nausea, vomiting, you're going to the loo more often, and in the urine we found these cells are high as well. So all these things are suggestive of UTI. So you disclosed, you explained the examination and investigation findings as well. That's it, right? What is this ICE? Let's talk a bit about it. Idea, concern, and expectations. Idea, concern, expectations. What is it? I mean, do you have any idea what's going on with you? Are you concerned about anything in particular? Is there anything else you were expecting from this consultation? That is what ICE is. Where should I do ICE? I would say do wherever you want to do, but do it. Can I do it more than once? Yes. Can I do I here, C here, E here? Yes, of course. But please, 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 please do it. That is the main thing, right? Now, for example, sometime you're suspecting cancer. It's very difficult for you to say that I'm suspecting cancer. So do I? What do you think you have? Do you have any idea what's going on with you? So the thing is, if patient is having blood and cough, patient is losing weight, do you think they have Googled it or not? I would say yes, they have Googled. And what Google is going to say? Cancer. So do you have any idea what's going on? Are you concerned about anything in particular? Doctor, I'm just worried about cancer. And what you will say? Yes, we are also worried about cancer because cancer is one of the possibility. So that is how you need to do. So ICE is really, really important. Yeah. And if you have to do further investigations, you can do further investigation, yeah. And then treatment, make sure you do symptomatic treatment and specific treatment as well. Symptomatic pain, I'll give you painkiller. Cough, I'll give you something for cough. Fever, I'll give you something for fever. Nausea, I'll give you something for nausea. And then the specific treatment you can do. Then medical treatment and non-medical treatment. Right? Which one you'll do first? Medical or non-medical? It depends on the case. I'll see the case and I'll manage it accordingly. And then you decide if you want to admit, admit. If you want to discharge, discharge. If you're not sure, keep the patient, call your senior, and that's it. Yeah. Follow up and warning sign. As I said, these are the must things. Follow up and warning signs. Yeah. And you can always offer leaflets and pamphlets to the patient as well for any condition. So this slide covers everything. If you know about this slide covers everything for you. And if you follow it, you will not have any problem in any history station, whether it is medicine or surgery or gynae or pediatrics, it can be done. All right. Okay. So what do we understand by interpersonal skills? Let's go through a bit more in interpersonal skills. History stations also include examination. Yes. So all the history station means examination as well. But as I said, sometimes they will give you the examination findings, but sometimes they are expecting us to do the examination. So these things you have to see. When you enter into the room, you have to see the room. Scan the room quickly. Do they have any examination instrument in the room? Do they have mannequin in the room? Yes. Then you have to do the examination as well. And if there is no mannequin and all, it means it's a history station where you will just mention about the examination. Then only they will give you the examination findings. Most of the cases they say, assessment. Assessment is history and examination. Examination, am I doing it or not? It depends on the station. So if there is a mannequin, you will be doing it. But if there is no mannequin, they might be giving you the findings, right? So that's why some examination stations are there as well. So 2 to 3 examination you'll get. Mostly examination stations are a combined station. Combined means you have history, then examination, then management. right? Okay. What do you understand by interpersonal skills? Number one is active listening. So we already told that we are not going to interrupt the patient. What we're going to do, we're going to listen to the patient. If patient is talking, please talk. I'm here to listen and I listen to them very carefully. Yeah. Second is signposting. So what is signposting? When you are moving from one part of the station to the other part, I would like you to signpost. Signpost is giving the heads up to the patient that these questions are coming. For example, the past medical history, you were asking the question. The last question was, anyone in the family having any medical problem? No, doctor. Do you smoke? See, smoking came all of a sudden. Patient wasn't expecting that. Like in the station, the example I gave you, I said, take sexual history. So if you ask directly, are you sexually active? Patient is like, why all of a sudden you are asking sexual history? It looks a bit awkward. So what I want you to do, signposting. What does it mean? Now, John, I'm going to ask you some questions about your lifestyle, like your smoking and alcohol. It might be related to your case. So can you please tell me, do you smoke? That's how you should do signposting. So sexual history. Maria, now I'm going to ask you about the sexual history. Don't worry, these are the questions we ask to everybody, those who come to us with these kinds of symptoms. So it might be very helpful in making your diagnosis. So could you please tell me, are you sexually active? So this is how you do signposting. Signposting doesn't mean you're taking consent. Signposting simply means you're giving heads up to the patient that these questions are coming, right? Summarizing, you can summarize the case as well. I would like you to summarize the case in the later part of the station. When you give the diagnosis, I would like you to justify the diagnosis as well. For example, you said you may have a condition called UTI because you're having fever, you have got nausea, you're going to the loo more often, you have got nitrates and leukocytes. So it's a kind of a summarization of the whole scenario with the positive findings that I want you to do. Eyes is the most important thing in your exam. I can't stress it enough. Now, a lot of people ask me, okay, why expectation is important? Let me give an example for expectation as well. I mean, if you ask what are you expecting from today's consultation, it might look odd, but no, this is what happens in this country. Okay, so let's take an example. There's a station on tension headache. Tension headache. So the treatment of tension headache is, I would say, lifestyle management. Yeah, lifestyle management is the treatment. So you did like a proper lifestyle management. Patient was smoking. You mentioned about smoking cessation. You mentioned about alcohol cessation. You asked the patient to have good diet. You asked the patient to have good physical activity. You did everything. Whatever you were thinking could be the management of tension headache. How many marks you got in management? You got one when you got the result. Like, why one? I did say everything. The thing is, you didn't fulfill the expectation of the patient. You're like, patient didn't tell me. But my answer is, did you ask the patient? Then you are like, no, I didn't ask even. So what are you supposed to do? So after doing the treatment or before you start giving the management, ask the patient. So you have got pain. I'm going to talk about your pain management and I'll tell you what we can do for it. And is there anything else you are expecting from this consultation? And then this patient said, yeah, doctor, I would like to have a CT scan as well. You don't do CT scan in tension headache, and that's why you never talked about it. But this patient wanted to talk about it, but you didn't talk, so that's why you didn't get marks for it. So that's why this eyes, idea, concern, expectation is very, 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 very important. Don't think it's easy. When you do it in consultation, sometimes it becomes really difficult. It doesn't come out that easily as well. So be careful on it. Body language, very important. Positive body language. Yeah. Involve the patient in the management. When you do the management, I would say 3 lines, say 4 lines, and give pause so that they can ask you question. If you are the one only talking, it is useless. You will not get any mark for it. But if you involve the patient in the conversation, they are also talking, they are talking more than you will get very good score, right? Can we tell the patient that you might not need a CT scan? Yes, the example I gave you, you can explain this is now a counseling station that you don't need a CT scan because what you have is tension headache and you don't need it. But, and if your symptoms are they don't go away, you can come back after a couple of weeks and then we'll see if needed, we can do a CT scan as well. So it's more of a counseling station now. So, but you are able to talk now because you did eyes, expectations. Yeah. Check and check meaning. So you will give the information in small, small chunks to your patient and then you check the understanding of the patient. Don't give everything in one go. Give a bit and check. Give a bit and then check. Yeah. What in this case the patient insists for getting a CT scan? That is a demanding case then. Yeah. You're saying it's a demanding patient. So there is a way you can manage the demanding patient. So first of all, you explain it to the patient why it is not a good idea to go for a CT scan. If patient is not agreeing to you, then you can scare the patient as well. That CT scan is kind of a harmful radiation. So why you want to expose yourself to the harmful radiations when you don't even need it? So that's what we can do, right? So it's a counseling and counseling and ethical how you manage more demanding patients. So I've got so many scenarios. Don't worry, we'll be practicing a lot of scenarios about it. Yeah, but I gave you a bit of idea. First, explain why the CT scan is not required. Second is scare the patient, my friend. Yeah. That's what you can do. Respond to the non-verbal cues as well. The most important thing. Yeah. See, this PLAB-2 exam, what you have to do is, see, guys, the important point is trust yourself. What I got from the candidates, a lot of candidates, they don't have trust on their language skills and all. Please trust yourself, trust your medical knowledge, trust your language skills as well. You have passed your OET or IELTS, so you can talk well. And trust me, you can talk much better than English people. English people, they don't know English. They talk in slang because that's their language. But if you ask for the grammatical mistake, they make so many mistakes. So don't worry about it. And when you prepare for OET, IELTS, a lot of people say, oh, you have to use complex sentences so you can get high score. I would say here, please use small sentences. Even if you're making some grammatical mistake, no problem. As long as you're able to make the other person understand, it's absolutely okay. Yeah. Also, I would like to advise you to practice in front of the mirror as well. When you practice in front of the mirror, you'll be able to see yourself and you'll be able to become better in terms of your facial expressions and all, right? Record your consultation. Who can be the best critique of your consultation? It's you. So daily, I would like you to maybe record one or two of your consultation and in the night, listen to it and see what I did right, what I did wrong, what I can improve. So that's what is required. Right. And even if somebody gives you feedback, oh, you did really well. Do you think it's helpful? I would say it's just a wastage of feedback, isn't it? If I mean uh, a candidate says, I mean, if you get a feedback, yeah, you could have improved on this, you could have improved on this. I think that is a good feedback, isn't it? It's not about you did really well. I mean, that's not what I want to hear. I want to hear where I can improve. That's the main thing, right? I want to do good in the exam. During the practice, it doesn't matter. Yeah. So you mean we should use long sentences just to make sure in order to get a good score? No, I never said that. What I'm trying to say is use small, simple sentences. That's what I'm trying to say. I mean, as long as you're able to make the other person understand what you're trying to say, it's enough. In OET, IELTS, you use complex sentence, so you can get high score, isn't it? In writing OET, what the usually instructors they say, use complex sentences so you can get B in OET. You can get 3 or 350 or more than that. Here, please use small sentences. Small sentences. Take it easy. You'll be fine. Be strong mentally, be confident, reassurance, and trust your language skill. Relaxed mind can do wonders. Yeah, that's the main thing. That's what you have to look for, right? So, guys, that's what I have got for you in an introduction. So, how was it? Did you like it? Did you think it makes sense? So this is how we do our courses. Our course, this is like live online, but we do the courses from the academy. Now, once you book the course, what we have in the course, I'll go through very quickly. I know you might be thinking it's too much of advertisement. Yes, it is for advertisement purpose, but I would like to tell you what exactly we have in our courses. And if you feel like joining, I'll tell you some discounts that is going on and how we can help you out. So when you join our course, so we are the only academy, I'm telling you, we are the only academy doing live in-person classes. So I'll be there, Nikhil will be there to teach you in person. It's a normal classes that's gonna go on. And all these classes are live telecasted as well. All these classes are live telecasted as well, right? Can you please explain a bit about the materials? I'll explain everything, doctor. I'll explain everything. Just give me 10 more minutes. Yeah. So you can attend our in-person classes live in the academy and you can actually attend it live online as well. So all our classes are live telecasted as well. Live telecasted as well. So that's the main thing. Right. I booked the course today and it expires in August, but my face-to-face classes will be in September. My exam is in October. So I'll tell you, doctor, it won't expire. I'll tell you what it is. Just let's explain this. You'll get all your answers, I would say. So first of all, I said we are the only academy doing live courses, so you can attend it in the academy live. It's not a hybrid course. It's not like we'll call you in the academy and play some videos for you. No, we will do it in person live. And that will be live telecasted as well, right? Now you will be getting the access of recorded videos as well. I mean, some academies are doing just this, some academies are doing this, we're doing everything. You'll get pre-recorded videos as well. When you book the course, you'll get the access of pre-recorded videos. Now, when you get the access, it will show you have got 4 months access. You know, this is the application system. I mean, you have to put some dates in it. So usually we give you the access of 4 months, but if your exam is after 4 months, what you need to do, just email us and we can extend it till your exam. Your exam is in September, October, November, December. Don't worry, just give us a date and we can extend it till that point. No problem at all, right? You will have comprehensive book material as well. So we'll be giving you the full booklet. That is like this booklet I made. It's around 1,000 pages, my friend. That's the booklet. So you'll have the PDF of this book as well if you want to read from your iPad and all, or else when you come to the academy, you'll get this book as well, right? So printed copy and everything. It's included in this price. You don't have to pay extra for anything, right? And then there are two mocks, 16 station. The way it happens in the exam, that's the same thing we will replicate here in the academy as well. What do you mean by the only academy do in-person classes? What I mean by that, doctor, is in the whole PLAB2, there is nobody who's doing live in-person classes for 12 days. If there is an academy, please give me the name of that academy. And please ask the student, those who have attended those, mostly they are running a hybrid course, meaning some days it's online, some days it's a recorded course, some days, maybe 1 or 2 days they're teaching in person. But we are the only one teaching you 12 days from the academy live in person. That's what I'm trying to say. Is Aspire to PLAB the same academy? Yes, doctor. Our full name is aspire to PLAB.com actually. So it's the same academy, yes. And then you can practice, yes, sim and practice, post-course support. I'll tell you, so this is our course. What do you understand? The course is in person. You can attend it online as well. Then you have got the recorded course as well. And you'll have the comprehensive material, the book as well, right? Now, what in every batch, what we do, we make a group as well. We make the WhatsApp group as well. And in WhatsApp group, you can put your question. We'll be able to answer your doubts and everything. So every class, every batch, there is a WhatsApp group, right? And support until you pass. Where is the academy venue? Academy venue is in Blackpool, doctor. So it's 281, 287 Promenade, Blackpool. FY16AJ. That's the venue, right? Where do I find the course start and end date and in-person classes? That's there on our website. We can send you the link, or if you would like to check it, it's www.aspire2plab.com. You can check it on the website, right? Or if you come in our group, we'll be able to share all the links and all with you. That would be easy, right? Now, if you are a group of 5, you can get £100 off as well. That's the thing. So, our course price is 649. If you're a group of 5, come together. So you will be able to get £100 each discount. So the course price is 549. So in 549, what you will get, let me tell you. In 549, 2 times in person, you can attend in-person classes, you can attend online live classes, you can pre-record it, you get mocks, you get comprehensive material, you can practice in the academy, the mannequin practice and everything. You'll have post-course support session as well. Let me tell you a bit more about the post-course support session. I'll answer Dr. Arnab just a sec. So what is post-course session? Let me show you. So what happened is we have got a weekly schedule. Classes are going on 12 days classes. That is different. And so the teaching session. So what happened is 12 days is different. Now we are having 2 to 3 sessions going on simultaneously in the academy. So you want to attend medicine, go and sit in that class. Another room, there is a class happening for the mannequin. You want to attend mannequin, go and sit in that class. So every week, Monday, Tuesday, and Thursday, we are having these sessions as well. So every Monday, like this is for the last week, like March 26th. So we had a teaching session at 2:30 for 2 to 3 hours, where we repeat all the mannequins as well. If you would like to attend, it's free for you guys. Those who are full batch candidates. Then there is a self-practice assessment of the mocks. What happened in spam? So, when you guys come to the academy, you're from different countries, and then you feel like, oh, I don't know each other. How can I make friends and all? So through this spam session, what happens? We will make you sit together, and then you'll be practicing station with different candidates. So this is how we sit, I mean, in front of each other, and you're practicing with each other. And in this group, there will be 2 to 3 mock examiners as well. So they will be helping you and practicing with you as well. So in 2 to 3 hours, what happen is you'll be able to practice 15 to 20 stations, different stations with different person. So you'll get 15 different friends, I mean, on the daily basis. So that's what we do in these spam sessions. Then there's hands-on mannequin. What is this hands-on mannequin? Obviously, mannequin in 3 days we'll teach in the 12 days course as well. But in hands-on mannequin, what happens is we take a small group. We'll take like say around 32 people. We'll divide them into eight. And what happens is we will have 4 rooms, and these 8 people will go in one room, 8 people in another room, 8 people and 8 people. And then there is an instructor for 1 hour. They will be able to practice under the supervision of that instructor. And that happens every week, my friend. Every week it happens. So the 26th March, this was the session. 26th March evening, there is a spam session. 27th, there is a hands-on mannequin session. Then 28th, there is a prescription writing. So this is like how the prescription writing session happens. So what we'll do, we'll give BNF to each candidate. Each candidate will have the BNF. We have got, don't worry, the 60, 70 BNF we have got in the exam. So you'll have the BNF, and what you will do, and we'll give you a scenario, and we will give you 2 prescription papers, and then time it, and then you will write it. And then the instructors will be checking your prescription as well and give you marks accordingly. And then 29th, for example, the next day, the Simban practice. Simban practice on the real Simban, monitor everything, and instructor will be there to guide you, and whatever mistakes you have done, so we'll be able to correct you as well. So, I mean, this is what is there. This is, I would say, most of the academy, they are saying this is the course. I would say this is not the course, my friend. This is what we are giving you on top of the course. What is the course? This is the course. You'll have in-person classes. The in-person classes are live telecasted as well. Recorded courses given, mannequin practice mocks. That is the course. But on top of it, you will get these weekly scheduled sessions as well. Everything is there. And it is, this is the package, right? So if I attend 12 days classes, can I practice in the mannequin till my exam? Yes. You'll be able to practice till your exam, And academy is open, my friend, 24/7 if you are living in our accommodation. So is there anybody who's giving 24/7 time, 20 hours, I mean, daily, 24/7, you can practice in the academy? Nobody is giving you. We are giving. If you're living in our accommodation, you will get 24/7 access of the academy premises. You will get the access of the mannequins 24/7. I know most of you, what happens is you come for very little time to the UK, and whatever time you have got in the UK, you want to spend more and more time in practicing on the mannequin. But most of the academies, they just close the center at 5 or 6. We close when? Never. It's open for you, right? So that's the main thing. If I book the exam for October, then around what time, what should be suitable for enrolling in a session? See, doctor, what you should do, I advise you to book it as soon as possible, because when you book, what's going to happen, you'll be able to see these recorded videos, and I would like you to book it and attend it online. You may not be in the UK, but wherever country you are, you're in Pakistan, you're in India, you're in Bahrain, attend it from there. Live, it's a live telecast. You can attend there. So more than half of the things you already know, you have almost prepared. So when you come to the academy, you can attend it in person. But if you feel I've got less time, I can't attend everything in person, you just do these practice sessions, the practice session that you have got, and that's it. So it's you who's gonna choose. Is there a package for only offline classes? I mean, see, everything is included. So the package is the same, my friend. So it's 649, but when you're a group, it's 549. Now somebody's asking, there's a group of 10. If there's not a group of 10, but it's a big group, 30, 40 people, please tell us, and then we will see if we can give you more discounts as well. But otherwise, this is the maximum discount we can do. But there is some more things in this. I'm coming to it. So 649 for both online and live classes. As if I register for the course in the upcoming week, I'll be able to use the online resources and attend the exam. Yes, absolutely. That's what I am trying to say. Yes. Right. Now, there's another thing going on. Just a sec. Is there any discounts available for alone people? Yes. So if you are a PLAB-able subscriber, because we are partner with PLAB-able. So if you are PLAB-able subscriber, you can still get £100 discount. Please email us, say I'm a PLAB-able subscriber, and if you have got that booking confirmation from PLAB-able, just email that also to us, and we will be able to give you the discount. Weekly sessions are available for long and are they only in person? Yes, weekly sessions. This one, the one I said, this is for only in person, doctor. This is only for in person, but our all the 12 days courses, they are live telecasted. So this is only for in person, and it's very effective when you are having exam in next 1 or 2 weeks. Yeah. Is there accommodation as well? Yes, accommodation is available. We have got different kinds of accommodation, and I'll share the link in the WhatsApp group. Please come in the WhatsApp group. This is the WhatsApp group for the discount. I know, like, you might be struggling to find a group. We can help you out in that as well. Please join this WhatsApp group. Come in the group. We'll tell you about accommodation. We'll tell you about how you can get the discount, and we can help you in making a group as well. That's the main thing. Now, there is something leaderboard. I'll tell you what it is. This is something you may get the course free as well. I'll tell you how. My 120 days complete before my exam. Will I be able to access the study material? Yes, 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 doctor. So what you have to do, simply before the expire of this 120 days, just email us and we can extend it till your exam. No problem. How long does it take each course? 12 days, doctor. 12 days, right? How much is the accommodation? Accommodation start from £18 till £30-35, doctor. It depends what you want. Yeah. Where are these live sessions, doctor? These are in Blackpool. So these happens there. Yeah. In Study Genie. Yeah. So the live sessions you can access through our application that we will tell you through the Study Genie. Or if you want to attend it in person, you can do it from our academy. Is the weekly schedule available for group batches or alone also? Is the weekly schedule available for group batches? What does it mean, doctor? Can you just tell me a bit more about it? What does it mean? Group batches as how far is Blackpool to Manchester? It's 1 hour drive, doctor. 1 hour. Can someone pay for only in person and mock session? Yes, only in person and mock sessions. Or you're saying only for mock session? No, you have to book the whole course. Only mock sessions are not allowed to book. Can we attend 2 times? That's once in June and then again in August. Yes. I mean, we say 2 times, you attend 3 times, 4 times, we'll allow you, doctor. No problem at all, right? So before I answer the rest of the question, have a look at this one. So there's a leaderboard thing. So we will send you a link. If you come in the WhatsApp group, we'll explain it to you. Please join the WhatsApp group. That's quite helpful. So there are things, I mean, so it will say, if you book our course, if you like us on Instagram, if you share it with others in the WhatsApp groups, if you like us on Twitter, it will give you some points. Who is on the top of the list? Who is on the top of nowadays? This list leaderboard is going on. Ankit is topping. I just took this picture last night only. Dr. Khalil is on the second point. Dr. Fortune is on number 3. Dr. Maliha, number 4. Dr. Balachandran, number 5. So this is how it's happening. You can take part in it. And what are you gonna get? Those who have booked the course, it's not like you can't participate. You have to participate in it. You might get a refund of it. For everybody, it's not like free. You have to pay and then you can get the refund. So those who are going to be on the first number, because it's valid till 30th of April. 30th of April, we will be announcing the result, who has won it. So for example, maybe Ankit will win, or Dr. Khalil, Dr. Fortune, Dr. Maliha. I'm not sure who's going to win. Let's see. So what you're going to get? So the first person who will be there, they will get the full refund. For example, you paid $549, you will get the full $549 back. Full course free. The second person who will be on the second on this leaderboard will get 75% off. So for example, you book the course in $549, you will get 75% off on this amount. Third person will get 50% off. So $549, 50% off. If it is fourth position, you'll get 30% off. So that's what's gonna get, right? 5th to 10th. Those who are on the 5th position to 10th position, they'll get free recorded course, or if they want, they will get a personalized course. They can choose what they want. Personalized course. What do you mean by personalized course? So we'll have one personal session with one of the tutor, 1-to-1 for 1 hour. So that's usually the price £99, so you can get that free of cost. And then those who are going to come from 11th to 40th position, What they're gonna get? They will get our smart course free. What is this smart course? We have got a 5 days smart course also. That is included for the you can have it. So smart course is what? Smart course is 5 days online course as well. So you can get that free of cost. Plus, you can get the audio book as well. We have got an audio book as well, so we'll be able to give you that audio book as well. So I mean, I know there's so many things that you can get, guys. So many things. So that's what we would like you to do, right? So you just have to take part in it, and I would like you to be leading on this leaderboard and try to be in the first few positions, so you may be able to get the course free of cost as well. How much does this cost to register for only online course? So if you'd like to register only for the live telecast course, you can get it in £99, doctor. £99. You can email us and we will be able to help you out on that. But in that, you will not be having any other facility. Only these facilities are there for our full batch candidates. Those are going to pay $649 or $549 after discount, right? So this is simply enroll in the course, start referring, and stay on the top of the leaderboard. And this the winner will be announced 30th April. And this is the link as well. We can share this link with you when you are in the WhatsApp group. Yeah, please do come in the WhatsApp group. Okay. Can you put this information in the WhatsApp? Yes, of course. Every information will be given to you in the WhatsApp. So WhatsApp is there for the good communication. So please do come. Do we have an accommodation? How much per night? So doctor, accommodation per night is different. What you are looking for? So it's the accommodation per night starts from £18, 18, and it is still £30, 30. So what kind of room you want, you can select it accordingly. Right? What if PLAB-able subscription is over? Can we say yes? It doesn't matter if your PLAB-able subscription is over. That's absolutely fine. You were a PLAB-able subscriber, then you will get the discount from our side. That's it. Yeah. Is the 5 days intensive course live or recorded? It's live, my friend, live. I know it's quite surprising for all of you because any academy, if you hear, they have got just recorded stuff. We have recorded stuff as well. That is given to you, no problem. But this 5 days also, it is live, 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 live. Yeah. Is there hands-on mannequin session at 11 a.m. under supervision? Will we be able to access the mannequin after that for practice like in evening? Okay, I'll tell you. See, classes going on separately in one room. Practice area is a big practice area where all the mannequins are there. It is available 24/7 for Aspire candidate, those who are living in our accommodation. Number three, these hands-on mannequin. For hands-on mannequin, we have different rooms. So hands-on mannequin will be happening in those rooms. And when hands-on mannequin session is going on, there are still classes going on. Still some candidates, they don't want to attend a hands-on mannequin this time. They might be attending next time. So they will be able to practice in the practice area. Don't think we have got one set of mannequin. We have got 3 to 4 sets of mannequin. One is in the class, one is in the mock area, one is in the hands-on mannequin, one is in the practice area. So you don't need to worry about it. It's a big academy. I'll share you the picture of the academy as well. The video, there's a 1.5 minute video we have got. I'll share it in the WhatsApp group. So you'll be able to see what I'm actually talking about. So yes, doctor, your question, answering your question. So yes, if there is a hands-on mannequin under supervision happening at 11 a.m., you can still practice that time in the practice area and every single mannequin will be there that time as well. You are absolutely right. Is everything included online in person 649? Yes. You might be thinking it's good to be true, but this is how it is. And I can say it with confidence. If there is any other academy, those who are doing this much in this much of price, you can join them, I would say. Because there is nobody who's doing it. We are the only one, and proudly I'm saying we are the only one academy doing live classes. That's the main thing, right? Okay, and how much discount for 5 of PLAB-able subscription? So if you are a group of 5 and all of you have got PLAB-able subscription, then we can give you a total of discount £120 as well. So you can get the course in £529, right? Accommodation included with the price package. Accommodation is separate, doctor. This price is for the course. Accommodation, it depends how many days you want to stay. Some are staying for 2 weeks, some are staying for 4 weeks. So you will pay accordingly, right? So please join the WhatsApp group, and we have a message, the WhatsApp group link as well. So if you're not able to scan it, I think we have mentioned in the chat box as well. Yeah, please join it. I'm sending it again. Yeah. Yeah, please. come in the WhatsApp group. Yeah. I have about 100 days still your course. I booked that on 14 July. If I get the visa, hopefully, what do you recommend? I cover or practice or in these days? So, doctor, what I will advise, Dr. Linda, what you can do is attend our live online telecast. All the courses which are happening. Now also the class is happening. I'm here. Dr. Nikhil is taking the class in the academy. The class is happening now. It's not only one person doing the whole Aspire thing. No, there's a group of people, us, I mean, we are running the classes. So I'm doing it online for you guys so you will know what the course is. And there is a class happening on live in the academy. And that live class is telecasted. So maybe Dr. Linda, you can be a part of it. I think that's the main thing. When you attend the course once, maybe online, you'll get a bit of understanding. Then you'll get your study planner in that class. Yeah. Can I book the course now and come as in person hours? Of course. The course is valid. We are here with you till you pass your exam. So book it now. Start preparing now. No. So why you're taking it till late? I know your exam is in August, but when you book the course now, you'll be able to get the material, start reading it. You'll have the access of recorded course, start watching it. You can attend our live online telecast as well. So start preparing today itself. It doesn't matter. Your exam is in November, your exam in December. Start today. Right? How can I join the WhatsApp group? What's the number? So, doctor, the QR code you can scan or the message. Let me send it again. I think our admin has sent it on the top as well. Yeah. Okay, here it is. I've just sent it again. Okay. If you are a PLAB-able subscriber and a group of five, you'll pay 449. No, doctor, you will pay 549. So only if you are a PLAB-able subscriber and a group of five, then you pay 529. You cannot combine all two, three things, then it won't be feasible for us. But yes, if you have both, we can give in 529 pounds. That's the maximum that we can do, right? How many hours per day for the intensive 5 day course and how much? Thank you. So if you're interested in 5 days course, this is morning to evening, doctor, start at 10, finishes at 5 or 6 o'clock. Yeah. I'm a PLAB-able subscriber, but I purchased the course in 649 without any discounts. What to do? What to do? Interesting. You can email us and do one thing. Doctor, you can be a part of this leaderboard. Just start doing it. If you get, like, say, on the first position, you'll get the full refund. If you paid 649, you'll get a refund of 649 only. Right? So that's what we can do. Will recorded session have everything like prescription and other stuff? Of course, of course, of course. Everything is there. Do we review mocks with feedback? Of course. When you do the mocks, you'll get two kinds of feedback. Nobody is giving two kinds of feedback. One is oral feedback soon after the mock. Another is a proper written feedback that you will get the next day within 24 hours in a PDF, which will give you proper how much you got in data gathering, how much in management, how much in IPS, what things you could do better. A detailed one will be there, right? I really love your course structure. I'm planning to take it soon. Thank you. I'm putting together such a helpful resource. Also have a question that might be slightly unrelated to today's session, but I would really appreciate and guidance. Due to some personal reason, I'm now planning to move to Ireland. I want to ask, if I pass PLAB-2 exam, can I use my PLAB result to register directly with the Irish Medical Council? Or is it mandatory to first register with GMC in the UK before applying for it? PLAB-2 exam can help me get exempted from the requirement registering from the Ireland Medical Council. So once you're done with the PLAB, doctor, they will give you the exemption for PLAB 1. You may not have to give the first part of Irish Medical Council exam, but the second part, that is press, you have to give. So there won't be an exemption for that. But please check it with the Irish Medical Council, because some of the medical colleges, some of the countries, they're exempt. They may not be giving any exam. For example, many medical colleges, I think every college in Pakistan, for Pakistan candidates, you don't have to give exam for Ireland. You can get registered straight away as well. That's the thing. Yeah. Okay, how long is the course? How long do I need to prepare? So the course is 12 days, but I would like you to have 6 to 8 weeks for this exam, right? So attend the course, then you will get the understanding how I should be preparing and practicing with my friends and all. So it might take in total 6 to 8 weeks, yeah? Or the live telecast posted WhatsApp group or the study genie. What do you mean? Are the live telecast? Live telecast, you will get an email. For example, you're registered and you want to attend the live classes for the next batch, for example. So you will be given everything, all the instruction will be sent to you via email and you can attend it through the Study Genie application. Yes, that's how you can do it. Are the online classes interactive? Yes, it's interactive. So it's a question answer is going to be happening. And as a online person, if you're attending online, you can ask a question like the one you're asking, and then we will be able to answer. After every topic, we answer the in-person candidates, and then we look at the system and we'll be answering you guys as well. Yeah. How long I need to be in the UK for a physical session before the exam? I need the plan to leave. So the thing is, first, I would like you to be first of all, I would like you to attend it live online maybe. So when you come to the academy, you may not be feeling like I have to attend every single class. You can attend only few classes. But what we advise, after the course, you should have 6 to 8 weeks. Now, I know you might not be able to spend 6 to 8 weeks in the UK. That's true. So attend it live online and then come maybe a month or 3 weeks before your exam to the academy. So that is something that you can. Is smart course included in 649? Usually we allow you to attend it one stop. Yes, yes, yes. Right. So that is it. I mean, if you've got any doubt, guys, so that's our WhatsApp number as well. You can WhatsApp on this number if there is any question, anything you have got. And info@PLAB.com, our website, and sorry, our email address, and these are our websites. You can have a look. And please join us and you can scan this QR code and then you will see. So if you see this photo, you will see what I mean to say. So you will see the people sitting in person. Yeah, in person. So they're attending in the academy in person, right? So they're attending in person. And if you see behind, it is live telecasted as well. So it's on Zoom. If you see, it's live telecasted as well. And online people will be able to see this. This is happening live. And this is what online people will be able to see. So that's how it is. Yep. Okay. Are the videos provided limited in the number of hours? No, it's not. I know it says 40 hours, but don't worry. Now we have made it unlimited. See it as much time you want, doctor. No problem. Is there a limit to the numbers of times you have access to the online and offline courses? Still now, no, doctor. But the thing is, if there is somebody who wants to attend it 20 times, then we may have problem because some people they start abusing the system. But otherwise, there is no limit, no problem at all. Are the batch date fixed or it can there be moderation? No, it's fixed, doctor. It is fixed and it's advertised on the website. We have put the dates for the whole year. Actually, you can check it on the website. How does the referral scheme work? How does it work? Just join this thing. Just come in the WhatsApp group. It's there. You just have to get this thing, aspire2club.com/mega giveaway. You just register yourself with the email address. Everything is self-explanatory there. If you refer us to somebody in Instagram, on Twitter, on Threads, on Pinterest, anywhere you'll get some points. If you advertise that on any WhatsApp group, it will give you some points, and the points are gonna be updated in the real time, live. And if you're on the top of leaderboard, and if you stay on the leaderboard on the top on the 30th of April, you'll get the course free of cost. That's the thing, right? That's how the referral system works. If the exam is in August, can attend in-person classes in August? Of course. But if your exam is in August and you're attending the course in August, it's not an ideal thing, doctor. What we advise, you advise that you should attend the course at least 6-8 weeks before your exam. So you can attend you can attend in August, that's fine. But I would advise you to attend maybe online live, maybe in June or July as well. That would be better. Yeah. My exam is in September. When can I start the 12 days course? Now, next course. Attend that. No, live online. And then when you come again, you can attend it again. You can attend the course once, twice, 3, 4, 5 times. What's the problem? So why are you just thinking, okay, I'll attend it that time? Attend it now. Okay, sometime what happened is you can't attend all 12 days in person because you are having a job and you're able to attend only 5 days. Fine. Attend next batch as well and attend 5 more days or 7 days which are left in the next batch. What's the problem? So that's how you can do it. If the exam is in November and if I want takes it, will you extend it? Yes, yes. It won't expire. That's what I'm trying to say. See, it is a system. When you put any course in any application, you have to give it a time frame. That's why we have given a time frame of 4 months. But it doesn't mean your course is gonna expire. You will have the course access. Don't worry. We have the course access till your exam. Don't worry. So book it now Start preparing now. And if you want us to extend it for next 3 months, 4 months, 6 months, 1 year, no problem at all. It is just we have to do it from the back end. That's it. Yeah. Do I also have the access to the recorded video of the smart program after 5 days? So, doctor, I am not able to understand. So, do I have the access of recorded videos of the smart program? No, that's not. Recorded course is separate. It's separate. No, it's included. If you are attending, if you're booking our full course, the recorded course is a part of it. So, that's the thing. Yeah. What are the teaching hours for 12 days? Live course start from 10, finishes around 5, doctor, 10 to 5, roughly. Yeah. My exam will be in October and I booked the course now from where to start. I mean, book or something else. They have got the recorded course. I would advise you to attend the live online classes once and then go through the recorded videos and the material that we have given it to you. That's the main thing. Yeah. How does the accommodation work? Who should we contact about it? Just come in the WhatsApp group again. I'll be able to give you the contact details for our accommodation team managers as well, right? So that's what we can do. All right. So, are you able to hear me? Okay. So, I'm in 3 days late for my 12 days course. Will I be able to access the next 12 days course? Yes, of course. No problem at all. So, if you missed 1 or 2 classes in this batch, what you do, you can attend it in the next one. No problem at all. No problem at all. That's what I want you to do. So, book the course, and if you're able to attend only few classes, that's fine. Attend in the next one. Miss that one, attend in the next one. Missed it, attend in the next one. We have got the classes announced for the whole year. That's it. Nobody is that much of flexible, to be very honest. Right. Another thing, guys. Now people say lots of new stations coming in the exam and all. See, every week we are doing the webinar on these new courses, new stations. Every week we are doing it. And some of them you can see on our YouTube as well. But some are only live and we don't share it with others. It is just for our Aspire candidates only. How often is 12 days course conducted? It's roughly twice in a month. Roughly twice in a month, doctor. The dates are there on the website. The dates are there on the website. If you open our website, www.aspiretoclub.com, you will be able to see that. Yeah. I'm inquiring about the live telecast, where I can find them. Are they posted on the Study Genie or on the WhatsApp group? It's there on the website, doctor. If you open our website, www.aspiretoclub.com, so if you just go to this email address, the website, there you can find the dates are already announced. The dates are same for the live or online live because, as I said, this is how it works. You can attend it live from the academy or you can attend it live online from your home. So that's why the dates are same, right? So you can check it on the website. Or if you come in the WhatsApp group, we can share you the link as well. So that's what I'm saying. Come in the group, then the communication can be easy. And I've got my my Aspire staff also there in the group, so they'll be able to answer quickly. Even personally, you can question, or you can question in the group, and we can do that, right? So let me check. Mhm. So, did you join this group? Okay, so yes, a few of you have joined, and those who have not, please do come in the group. And that's what I'm saying. Our admin will help you in making a group as well. That's the main thing. They are like, how I'm gonna be able to make the group and all. We will help you. That's why come in the group. 5 of you will meet together. Group done. Book and start preparing. Start preparing today. That's what I'm trying to say. Start preparing today. Don't wait. Don't wait. Right. And hello, I'm inquiring about the live telecast where I can find. Okay, let me tell you. Let me open the website and I'll tell you the next dates, doctor. Uh, uh, so, my friend. So, doctor, the next batch. So, the batch is going on. The batch started on 31st of March. It's going to end on 11th of April. So, one batch is going on, as I said. The next batch is going to start on 21st of April, if you want to attend. And then it's going to finish on 2nd of May. The next is 12th May. 12th May is going to end on 23rd May. Then the next is on 2nd June. The next is on 23rd June. The next is 14th July, 4th August, 25th August. 15th September, 6th October, 27th October, 17th November, 8th December. The whole year schedule is there on our website, right? So that's the thing. And now we have posted it on the system as well. Yeah, we can check in the chat box. These are the dates of our classes. Yeah. So that's the main thing. Yeah. Any other question? Do we have anybody from Turkey here? Anybody from Turkey? Just say hi in the chat box. But this one, how long before the exam should we join the in-person academy? I would say 4 to 6 weeks, doctor. That would be beneficial. But if you are not in the UK, you are outside, then maybe just come and attend it a month before. I think that would be beneficial, right? Is there anybody from Turkey here? And I will attend the classes from 12th of April. Right. 12th of April. Why 12th of April? Doctor, 12th of April, the batch is finishing. No? So the next batch is 21st April. 21st April. So if you see, these are the dates. So next batch is 21st April. The batch is going on. It's going to finish on 11th April. So if you want to attend the next one is starting on 21st of April. So you can attend that. Yeah? Yes, doctor, you can attend. Just email us that I want to attend the batch from 21st. You will get all the information about that from Turkey. So if you know, I mean, I'm not sure if you're aware of it or not, we are having a class, a batch going to happen in Turkey, Istanbul at Taksim Square in Kent University. It's going to be starting on 21st. On Monday, is it 21st? It is 21st of April. So if you would like to be a part in it, you can attend it there as well. 21st of April. We are having a class here in the UK as well. We will have a course starting in Istanbul as well. Right, so I mean, those who are from Istanbul, so and you don't have to pay extra. Those who are in Istanbul, it's not like you have to pay extra to attend there and here. Everything is in one package. If you would like to attend in Istanbul, most welcome. And that's what I was saying. If anybody wants us to come in your country, you can invite us. We'll be more than happy to come. Yeah, and if you're a group of 20, 30 people, we'll be coming and doing the course there for you guys. If you are interested, just let us know. Just book the course here, and that can be transferred, and you can attend the course in your country free whenever we announce it. Right. So yeah, that is it. Please join this WhatsApp group, guys. Please join the WhatsApp group, and if needed, what you can do, maybe you can just take a picture of this page. So I think here all the contact details are there. So yeah, our phone number, our email address, our websites, and the QR code. Please scan and come in the WhatsApp group, and we will help you guys. Come on, we'll help you in making this WhatsApp group. Yep. And all right.